So whether you have lost a tooth, you are considering an implant, someone who is just curious about understanding, this episode is definitely going to help your.
The first and foremost that I get to hear is that it is painful. So the procedure is painful. If the base is not strong, the result is not going to come back strong.
Correct. Will it look like my original tooth?
You are not mentally prepared to do the procedure, don't do the procedure. Take your time, understand, do your own research. Once you're decided, definitely we will be able to help.
Namaste everyone. Welcome back to yet another episode of podcast with me. I am Dr. Amitabh Kulkarni. This is a platform where complex topics are simplified with the help of experts in a clear, simple language. Now today's topic is something which is on many people's mind: dental implants. So whether you have lost a tooth, you are considering an implant, or someone who is just curious about understanding, this episode is definitely going to help you and increase your information. I'm very happy I'm joined by Dr. Neha, who is an experienced prosthodontist who has treated countless patients with this issue and brought a smile to their face. Dr. Neha, thank you very much for accepting our invitation. Dr. Neha, can you tell us something about your background?
Sure. Thank you, Dr. Kulkarni, for having me here on this platform. I'm Dr. Neha Jain, and I'm a prosthodontist and an implantologist. And basically, with my field, what we deal is prosthetic part. If you have any tooth that is missing, is broken, is chipped off, you're not able to chew on any side of your teeth, or you feel your teeth are not aligned properly, we are the best people to help you out in these scenarios. If you have any of your tooth missing, implant becomes your best and the first treatment of choice. So I hope that in today's episode we will be able to help you out.
Yeah, thank you, Dr. Neha. We are very lucky to have you here. So let's jump right in and try to get the information. So let's start, Dr. Neha. Now many people hear about dental implants, but they may not be aware about the complete information. So can you just share with us what exactly is dental implants and how do they work?
Okay, to make you understand in very simple terms, dental implants are actually screws. Now, when we say screw, it's not a screw how we use in the houses and our construction.
Correct.
It is made up of a special material. It's
Okay.
a titanium material that it is made up of.
Yeah.
Titanium has its property that it will bind to calcium, which is there in the bone.
Correct.
So once the titanium comes in contact with the bone, inherently it binds with the bone and it becomes one. So when we put that titanium screw into your bone, it becomes like your natural root of your tooth.
Okay.
So once it is there inside, it heals up. It needs some time, but once it heals up, it becomes as good as your original tooth.
Correct.
So that is what the basic dental implants are.
Yeah, that was very simple and very understandable information. So is everyone suitable for this particular implant? Are there any people who are not suitable for dental implants?
No, almost each and every person is suitable to get a dental implant.
Very good.
But yes, there are certain conditions in which we have to be bit more careful, especially if any patient has a certain medical condition. If someone has uncontrolled diabetes,
correct,
we need to get it under control. So there is nothing like no, we cannot do. Absolutely, we can do with help from the medical side management. Sometimes in certain cases the bone may not be on a healthy level, but we can bring it to the healthy level by adding a bone graft, or maintaining a good calcium and a vitamin D level in the patient.
Correct.
So there is no absolute contraindication, but if there are certain conditions, we need to check a patient before we start, but in almost all the cases, dental implants are possible.
Maybe if someone is uncontrolled diabetes, then you control the diabetes first, and then he will be suitable. Or if the bones are weak, then you supplement with vitamins, calcium, and try to strengthen the bone before undergoing.
We definitely go for certain blood tests before we start the procedure, or before during the diagnosis part. And if there is certain situations that we need to take care of before we prepare the patient, yes, we do that.
Yeah, so that's very reassuring to know that almost everyone is suitable for a dental implant. So in spite of this, there may be some misconceptions you may have encountered. So what are those common misconceptions you hear about dental implants?
The first and foremost that I get to hear is that it is painful. So there is certain amount of discomfort, but it is certainly less painful than getting an extraction done.
Okay, yeah.
It is a quick process most of the time, because most of the time you are already prepped up for the procedure. Second most important thing that I come across is the expense that comes. But if you see at the long-term viability of the treatment or the long-term factor that is involved, it is a very reasonable option.
Yeah, it's still financially viable option. Yeah. So then, so how do you prepare? What type of pre-surgical or pre-procedure preparation is required in all these patients who are planning for a dental implant?
So first, the patient has to, be mentally prepared. They should have the basic information regarding the number of steps and the time that is involved.
Correct.
Second is the diagnosis part. We require a complete mouth X-ray. There is a 3D imaging that is involved, which we require to get the exact amount of the bone level and the space that is available, and if we need to do anything extra procedure involved with it. We also need one basic set of a measurement or the impression to get how much of the space is again available.
Measurement of what exactly?
Of the jaw, sir.
Of the jaw.
Of
Okay.
the jaw.
Okay.
And sometimes we also may need the bite for the patient to just to have an idea, because after the implant we are also supposed to give a crown on the tooth to just to get a final process, the final product that we are supposed to deliver to the patient.
Correct.
So these two major things are involved: a basic X-ray and a basic 3D scan.
Yeah, and it is not wise to undergo a procedure without a complete pre-operative or pre-surgical assessment, according to you?
Yes. It is
very important.
There are
Yeah.
multiple anatomical structures that are there in the mouth, which we need to take care of.
Correct.
Okay?
Correct.
So the pre-op itself takes some time.
It's very crucial. It's very crucial about this. Now you mentioned about bones and gums in the first few lines. So how important is the bone health or gum health in someone who is preparing for a dental implant?
They are very, very important. In fact, the most important part. Okay?
Yeah.
Because as I said, the implant is supposed to go into the bone.
Bones, correct.
So with everything we do around, if the base is not strong, the result is not going to come back strong.
Correct.
So we need to make sure that the bone is strong. So the first thing, as I mentioned, the calcium and the vitamin D level normally should be at a good level, at a average and a normal.
So do you routinely check calcium and vitamin D levels for every patient who is undergoing implant?
If it's an elderly patient, female patient, yes.
So maybe in a high risk people whom you feel may not be
and also we need to go a little bit into the patient's history, because why the patient lost the tooth in the first place.
Correct. Yeah, that may give us some clue about why this has happened.
If patient already had a gum disease to start with, definitely we have to look into the factor.
Yeah. So whenever the term comes as dental implantation or dental procedure, the first question I'm sure patient must be asking you is about pain. So can you tell us how painful is this procedure first of all, and if at all there is a pain, how should patient be prepared for to handle this encounter?
So the procedure is painful. Painful in the sense that yes, the patient will have little bit of discomfort for a day or two. But the medication is advised pre, during, and the post procedure.
Okay.
So the medication are the regular analgesics and the anti-inflammatory that we regularly give to the patient, which takes care of the pain and any mild inflammation that might set in. If the patient is taking those medication, absolutely it is very comfortable process.
So even if the patient is painful, do you do it under like something like a local anesthesia
Yes.
or something topical anesthesia? What exactly?
Initial, it is under local anesthesia.
It is under local
It is under
anesthesia.
local
So the
anesthesia.
pain component will be
During the
nullified
process,
actually during the
absolutely
procedure.
patient is completely comfortable. He has to be comfortable before we start any
Correct,
procedure.
correct. So this is very, very important for our viewers to understand that yes, you may hear about pain here and there. Yes, any procedure will have some prick will cause some pain, but your doctor will make sure that you receive a proper good local anesthesia so that the pain or something related to pain will be
And
minimized
just
later.
add on
Yeah.
to this that even for the prick, we give topical anesthesia.
Topical
We try
anesthesia.
our best that you do not even feel the prick.
Yeah,
on
so
the
definitely you will
local
not
anesthesia.
experience much pain. What is the role of imaging in this, like say X-ray or any other investigations which you do in most of these cases before or after procedure?
Yes, so first is definitely a basic panoramic X-ray. But the panoramic X-ray is a 2D image of your jaws that we get.
Correct.
But in actual life, we are all made in 3 dimension.
Correct.
So we do a 3-dimensional CBCT, which is a cone beam somatography that is done for the jaws specifically.
CBCT.
CBCT.
Okay.
It's a CT scan which is done specifically for the jaws.
Correct. Correct.
That is required because we need to make sure the major anatomical structures, because on the upper jaws we have the sinus for us, and in the lower jaw we have a very important nerve that passes through.
Correct.
So
Correct.
we need to take care not to cause any harm to
Harm
these anatomical structures.
So CBCT or say X-ray, panoramic X-ray is done for every patient?
From our side, yes, we advise
Almost
for each
all.
and every patient.
Now I know X-ray is easily available. Is CBCT also easily available in most of the hospitals where the procedures are being done?
Yes, at a place where the regularly implants are done, CBCT is available most of the time.
Okay, okay. So I'm sure patient must be asking, will it look like my original tooth? So what is your reply to those questions?
Yes.
So it does look like a real tooth in terms of texture, color, and all those things.
Yes, once it is integrated, it feels like a natural tooth.
Yeah.
Once we give you a crown on top of it, the appearance looks like almost like a natural tooth.
Yeah, so I'm sure the patient must be happy once they undergo this procedure. So how long does this process go on? Like how many weeks or months usually it takes from beginning till end?
Yeah, from the first sitting for the patient, from a diagnosis till the final restoration, you are looking at minimum 3 to 6 months.
3 to 6 months.
3 to 6 months. Normally 3 to 4 months, but in case we need to do any bone procedure like a grafting, or we need to add some supplement, 6 months.
3 to 6 months. And how often do they need to visit you during this 6 months period?
It depends upon the procedure, but around between 2 to 3 weeks.
Between 2 to 3 weeks from till the final crown. Yeah. So this is from your end, but from patient point of view, what all care they should be doing during those 3 to 6 months when the implantation is being done, or what mistakes they should be avoiding during these 3 to 6 months?
The most important thing patient need to take care of is the oral hygiene.
Oral hygiene. Okay.
Once the implant is placed in the oral cavity, there is a waiting period of around 2 to 3 months. Okay, so during that period of time, they have to make sure that they are able to maintain a good oral hygiene in that area. Okay, so that includes your brushing, your mouthwash, massaging that area so that the healing is proper, and yes, and avoiding smoking. Very, very important.
Avoiding
factor.
smoking. This is
Very, very
another important message. Yeah.
Yes, very important factor for dental implant.
Yeah. So viewers, please understand, smoking not only harms your heart or brain or any other organs, it harms your teeth also. So just stay away from smoking. Very important message. Thank you, Dr. Neha. So, how durable are the implants nowadays? Like, I'm sure the technology is changing every decade. So, once an implantation is done, is it like a lifelong implant?
Lifelong, for normally implants will last you at least 15 to 20 years.
15 to 20 years.
A very good success rate.
Okay.
So again, most of the time, nothing happens to the implant. But like with any technology that happens, that it needs to be taken care of.
Correct.
So that involves regular visit to the dentist. So for the first time when we do an implant, we advise a follow-up after 1 month, then after 6 months, and then after every 1 year.
Every year.
A follow-up after every 1 year.
Yeah, and on an average, even with the best quality implant, the life is 15 to 20 years, you mean to say?
It can go on even longer.
It can go on even longer, and they will always have an option to do the procedure later on?
Yes.
It depends.
Unfortunately, if it is required, it can be done.
That option is always there. Now, since it is a dental procedure, I'm sure cost is a major concern. I'm not very sure how insurance coverage works for this procedure, but in today's financial language, everyone is looking at ROI, how much investment they have done and how much will be the return. So for an average implant, how cost effective it is and how beneficial it is in long run, in considering the investment they have done?
If you consider it as a ROI, it is 100%.
100%.
Whatever you put, you will get it.
Yeah. So definitely, yeah.
Yes. So it depends again how you are maintaining. If you are taking good care of yourself, you are taking good care of your own oral health, it will last you a lifetime.
Yeah. So if a proper care is taken, it's going to give you maximum benefit. So definitely high ROI is there. So if it is actually needed in your case, definitely it's worth investing in this particular implant. Now, for someone who, for some reason, if it cannot be done, who is hesitant or who cannot afford, or for some reason it is not being done, are there any alternatives to dental implants?
In certain cases, yes. The second best option after implant will be doing a fixed partial denture, which normally people understand as a bridge, but that involves grinding your front and the back tooth.
Okay.
But in certain cases, if the back tooth is missing, then the next option comes as a removable denture. If patient does not cannot do implant for any XYZ reason, then it will be a removable denture. So first option implant, second will be a bridge, third will be a removable denture.
Yeah, and it is like cost effective for someone who is probably and it is easily available.
It is easily available. The duration of time involved is much less than the dental implants.
Okay. Coming to last couple of questions. Now, what are the common, say, fear, myths you have heard about a dental implant, and which should be actually totally, probably it's false. So, which you want to convey to our viewers from this discussion?
First is the pain. People need to be leave the fear of being in pain.
Correct. So it's not painful procedure.
It is not painful. There are multiple options available to make it completely pain-free. Along with the pain-free, it can be completely free of anxiety. There are different sedation options that are available for
Correct.
people who are really scared.
Correct.
There are so many sedation options that are available that can be done along
Yeah.
with local anesthesia.
Correct. Yeah, thank you very much. So, and coming to the last question, for someone who is very hesitant, what single piece of advice you want to give it to the people from this podcast?
See, if you're hesitant, you are not mentally satisfied, or you are not mentally prepared to do the procedure, don't do the procedure.
Don't do the
Yes,
procedure.
I
Yeah.
will never force the patient just to do the procedure.
Okay.
Because if you are not willing to accept it, maybe the body will not accept it.
Correct.
Okay, because at the end of the day, it is an implant. Your body needs to accept it.
Correct.
It has to integrate it inside. It has to become a part of yourself.
Yeah.
So if you are not ready, don't do it. Take your time, understand, do your own research, take multiple opinions, make your decision. Once you're decided, definitely we will be able to help.
Yeah. Now, I'll just add one more question to what you just discussed. Now, what will happen if they don't care for the implant? What are, in other terms, what are the possible complications related to implant which they should be watching for in the lifetime?
Because implant is as good your own tooth.
Correct.
At the end of the treatment, because it's like a tooth, you can get everything that you get on a normal tooth.
Correct.
It will not get a caries because the tooth, it's a crown. It's not a normal organic tooth.
Correct.
But you can get pain, you can get infection. It
Mm,
can
yeah.
lose the bone support that is there. It can start moving. So all the problem that come with natural tooth can also be there with the implant.
Correct.
So how you take care of your
Natural tooth.
has to be extended to a dental implant.
Yeah.
Once you put the implant, you cannot just think that okay, the implant is done and nothing is going to happen.
Yeah.
You have to take care of.
Yeah.
If I can extend, I normally say it's like a car. You have got it, so you have to get a servicing done every
Regularly,
6 months or
yeah.
every 1 year
Correct.
to get
Correct.
it done.
Yeah.
Okay,
That is
so-
very crisp and clear advice. Yes.
So you need to take care of it.
Yeah.
So whatever happens with the natural tooth can happen with the implant also. So oral hygiene and maintenance is very, very important.
Yeah. Thank you, Dr. Neha, for the clear, insightful advice for all the questions which we have asked. This takes us to the next level of discussion in the podcast, wherein we ask some one-liner questions which we expect in one-word answer. So, are you ready for this?
Oh, I hope so.
Yeah. Okay. So we just need one word. Okay. What is bad for teeth? Tea or coffee?
Honestly, coffee.
Coffee. Okay. One food you always warn patients about?
Candies.
Candies or
Yeah.
sweet things. Correct.
Sweet things, but candies. Yeah.
Candies. Okay. Your go-to advice for a confident smile?
Wear it with confidence.
Wear
That's
it with
it.
confidence. Perfect. Most common myth you hear about dental implant?
Same. It's painful.
Painful. Okay. What is your favorite dental innovation?
CBCT, 3D scanning. It's God given for us.
Correct. That has helped you a lot in your day-to-day practice. One thing patients should never do before visiting a dentist?
Don't try to brush too hard. We get to know it.
True. What is one thing you wish everyone knew about the oral health or dental health?
It's not a one-day process. It's a continuous process.
Continuous
what you
process.
have been doing it for over the years is the result that you get later on.
Correct. And the last question, if you could fix one bad habit for everyone or everyone's routine, what would that be?
Don't brush in a hurry.
Okay,
You have
take your
to-
time.
You have to dedicate at least 2 minutes of your whole day
Yeah.
to your teeth.
Yeah, because that smile you are going to wear for next 24 hours. So
For your whole life.
yeah, whole life. Yeah,
Whole
yeah, yeah,
life.
yeah, yeah, yeah. So that brings the end of this very interesting, insightful, knowledgeable discussion with Dr. Neha. Thank you, Dr. Neha, for this information in a simple language for everyone of us to understand. Friends, please understand, as Dr. Neha clearly mentioned, that everyone who needs a dental implant can go ahead with a dental implant. Maybe if your medical issues do not allow it to be done immediately, it is possible, but then after correcting, say, diabetes or blood pressure or any other infection, definitely you are eligible. What is very important is dental implant is not just a one time procedure, it's a continuous care you need to take of your teeth, and that is going to that should stay forever, lifelong, so that you will be able to wear that confident and beautiful smile. If you have any questions related to today's discussion, please enter it in the comments. We will be very happy to answer to those questions. If you want Dr. Neha to discuss any other topic related to her field in future, please do mention it in the comments, and we will be very happy. We will request her, and as per her availability, we will be recording. Please subscribe to the channel, share this episode with someone who is probably planning for a dental implant in future, or who just want to understand what exactly is a dental implant. So this is me, Dr. Amitabh, with Dr. Neha, signing off from today's episode. Keep smiling. Thank you. Thank you,
Thank you,
doctor.
doctor.
Thank you.